What a year it has been. All right, as I mentioned, I'm going to go over a little bit of housekeeping with each of our guests today and our viewers. We have a great lineup for you today. We might end a little early, but since March of 2020, we've been hosting this weekly program every Tuesday at 2 p.m. Eastern for about an hour, featuring our faculty and staff as it relates to brain health. We want you aging well, we want you healthy, and we want you informed. So take a few minutes to complete the poll if you have or have not. Again, we want to welcome you and thank you for joining us. If this is your first time, get ready for a lot of information. We cover quite a bit of content in just a short amount of time. So take this time to go grab a pen and paper. And as I mentioned, we begin with exercise. So you definitely need a sturdy chair, and we recommend you only participate at your own risk, okay? Because we say every week, what's good for your heart is good for your brain. So with that said, we want each of you to take a few minutes. We're gonna take about 8 or 9 minutes, do a little exercise, kick off with that, and then we're gonna turn it over to Dr. Parker, who's gonna introduce our faculty that are gonna be talking about stress and COVID and the brain and respiratory viruses. So all of that in under an hour. All right, are you all ready? And remember, you can post your comments or your questions in the chat, or you can use the Q&A function. And Dr. Kulshreshtha, we will get you converted over to a panelist here shortly. Right now, we're just going to take a few minutes to begin with exercise. All right, I've done all my housekeeping. I was doing a little stalling there. I want to make sure all our panelists are taken care of. All right. Okay, who's ready to exercise? Let's see. I've got maybe some technical issues going here. All right, let's stop that share. Okay, let's get moving, guys. John Lewis is going to join us. He's going to kick us off, as I mentioned, with some exercise. Then I'm going to turn it over to Dr. Parker. She's going to introduce our renowned guest today. And remember, you can use the Q&A function as needed. All right, come on, Zoom, work with us today. Y'all can tell me what you see there. Hi, Ms. Brenda. Thank you, guys. Welcome, welcome. All right, I hope you got a sturdy chair and you are ready to get your heart up. Take us away, John.
Today is a celebration of life, and you talking about getting active for the first anything around your house. Let's go get it now. We're gonna work that upper body first, that cardio, the abs, and then we're gonna get a
Okay, so we're getting feedback from you all stating that you can't hear. So we will go on with our program. Dr. Parker, if you want to go ahead and get started, and you have a little bit more time today since we had a couple technical issues with John Lewis, but we did have to pre-record him because he is right now receiving an award for all of his work in the community, working with seniors and helping them get healthy. So applause and bravo to John, but he couldn't be with us today. So we pre-recorded his session. Unfortunately, it didn't work out for us. So we'll just send out a link and you can watch it at your leisure. But I'm going to turn it over to Dr. Parker. That gives us a little bit more time to cover all of this amazing content today. Welcome, Dr. Parker.
Good afternoon, everybody. Thank you, Cornelia. Thank you all for joining in and tuning in as you have every week since we started the pandemic. Special treat today. We have two very special physicians that are coming before you today. Dr. Ambar Kulshreshtha, who's a family physician here at Emory School of Medicine and works in our family medicine department and at Emory University Hospital at Midtown, will be here to talk to you about stress, the effect of stress, and what it does to the brain. And our second presenter will be Dr. Sujit Suchindran. And hopefully he'll forgive my pronunciation and he'll tell us how to pronounce his name correctly. He's going to enlighten us about the importance of respiratory viruses, illnesses, and their effect on us. Again, Dr. Ambar Kulshreshtha and Dr. Suchindran. Dr. Kulshreshtha?
Thank you, Monica. It's a pleasure to be here. And I would, do you want me to get started first?
Yes, sir.
Great. Okay, awesome. It is very nice to see everyone. Just give me a second so I can get my presentation started. Can you all see my screen?
Yes.
Great, thank you. So thank you for the introduction, Monica. It's a pleasure to be here and talk to everyone about the role of stress and how we can improve brain health along the life course. So as Monica said, I'm a primary care physician, also a hospitalist. So I like to see my patients comprehensively. So I worry about not just preventing brain disease, but also heart disease, improving their physical health. All of that is important to me when I see a patient. So let me get started with what I want to talk about over here. So when we think about brain health, what comes to mind, right? You have to almost think about someone who has very good brain health. So you think about aspects of that, which includes good working memory, executive functioning skill, ability to write checks and do other things, recall long-term memories, and having a good sleep regulation, as well as an ability to respond to stressors and be in a state of calm after that, right? So that's how we think about good brain health. Now, we have, figured out, and as Cornelia just said in the beginning of the talk, that heart health and brain health are very closely related. And that's, fascinating to me because if there are common risk factors that affect the heart health and the brain health, then my job as a primary care physician is to emphasize on those common risk factors such that we can promote good health for our patients and people that we see in clinic. So all these, this diagram looks complicated, but the idea is through a variety of mechanisms, which include genetic as well as the environmental exposure, they all sort of interact with each other to lead to heart health affecting your vascular health, which is basically the health of the blood vessels, and that also circulate in the brain. So all this becomes very interrelated and of interest to us because through common risk factors that you see below, we can control a lot of these things. So let's talk about some of our fears as we are all, as we all grow old, we worry about common causes of death. And as you can see in the United States, the leading causes of death are over here: heart disease, cancer, respiratory illnesses, stroke, Alzheimer's. But when we start, thinking about these conditions, we often like to actually understand what are the real causes of death. What actually led to these conditions which cause people to die sooner than expected? And then we find that overwhelmingly, it's just most of these conditions are lifestyle related. It's poor diet, it's physical inactivity, it's tobacco consumption. So to me, this is a more powerful things of what we can change so that we don't end up in this graph of having any of these conditions to begin with. So that led me to understand of how we can conceptualize about what it means to have a good heart health or a brain health, right? So I worked with the American Heart Association on this area, and we came up that we have to give a definition to things. We have to give a structure to it to make it easy for people to understand, for their physicians to understand, and for people to achieve this. So what we did is we came up with this sort of a definition, which included some physiological factors like your blood pressure, your glucose level, cholesterol, and we defined what does it mean to have ideal level of blood pressure? What does it mean to have poor level of glucose control? And similarly with cholesterol. Now, as you can see, we just not only care about physiological factors, but also behavioral factors, which, as I mentioned, are responsible for a lot of chronic conditions. So in this sort of definition, we also incorporated smoking, physical activity, and healthy diet. And healthy diet can go through a lot of, discussion regarding what does it mean to have healthy diet. So we called it the DASH-like eating plan, which is basically eating more fruits and vegetables, fish, increasing the fish consumption, increasing fiber intake, and lowering sodium and sweetened beverages. So that if you can actually, if you do 4 or 5 components of this DASH-like eating plan, then you are in an ideal state of healthy diet. Similarly, for physical activity, if you exercise greater than 150 minutes per week of moderate physical activity, or if you are able to do intense physical activity for greater than 75, you are at an ideal level. Smoking, we can expect that the ideal level is you never smoke, right? And similarly, we came up with a definition for the BMI as well. So taken together, we defined this concept of Life Simple 7, which is how we conceptualize heart health, right? Now, here's a snapshot of United States looking at how well people are doing. This is from some studies that are representative of the US population. And you can see how interesting this is because we have really made good strides in smoking. This green over here shows a lot of people don't smoke anymore. Like if this was done in this study was done in the 70s or 80s, this would have been a very small proportion because smoking was so prevalent. But look at how much we need to go for ideal diet. Our diet consumption and everything is what we eat is on the very unhealthy side, on the poor diet. So Americans are eating a lot of unhealthy diet, and we all are aware of that we need to change it, right? So you can see how with each of these 7 factors, which we called Life Simple 7, we have ideal levels of each one of them, and the US population is represented in terms of their different levels, with more work to be done for physical activity, diet, and improving our body mass index. So our goal, in doing these surveys is to every few years see how the US population is doing. And as you can imagine, the red over here does show that our cardiovascular health and brain health is not at a good level in these states which are shown in red. And that's very informative to me because it tells me where to focus on as a health researcher, as a policy person. Where do I need to put more resources and what do I need to do? Because why are diets and physical activity in terms of at poor levels in these particular states? And it is not surprising when you've heard of the terms like stroke belt, heart failure belt, all run through these states because people die so often from these conditions. And as you can imagine, even people with dementia are much more likely to be in these states compared to others. And which brings me to our home state of Georgia. How do we look like? Well, as you can see, it was part of those red states here in terms of having Alzheimer's mortality rate being the third highest in country. And if you look at factors, the prevalence of the risk factors that I was just talking about, we have a lot of work to do over here, both as in the community as well as in primary care offices. There's a high prevalence of risk factors. Smoking is at 16% still. Lack of physical activity, unhealthy diet, diabetes, hypertension. All of these are problems that are there in the population, which will lead to these chronic conditions being more prevalent and high risk of morbidity and mortality. And we just talked about that Georgia is also part of this infamous stroke belt, with an average of stroke mortality being 20% higher than the rest of the United States. And when I do community talks, which is why I love doing sessions like these, is we try to sometimes inform people who might not be aware of this thing. And I feel as a PCP, I feel that is my biggest contribution, because I'm able to sometimes educate people who are not even coming to doctors, right? So I feel that itself is, spreading awareness is actually the most fundamental thing the healthcare system can do for this community, which is why I love these Brain Talk series, because we are really connecting with community to inform, educate, and get people to get screened earlier. Now, I mentioned that the 7 factors that are there in the US population, and some of them are not at good levels, we want it to be actually personalized for you. So the way we work with the American Heart Association is they actually came up with this My Life check. So you can actually put in your numbers on this website, and there is an app also on it, and try to see where you are at, right? It'll give you a score between 0 and 14 with each level of your risk factor. And what is powerful about this summary report that you will get, it'll give you recommendations of what you should do and what you can do, is that with each improvement of 1 unit of your score, you reduce your risk of death by 18%. You reduce your risk of heart disease by 23%. You reduce your risk of stroke by 8%, end-stage renal disease, which is going on dialysis, by 22%. And also you can decline your risk of Alzheimer's. And we have gone on to show that these common risk factors are actually responsible for a large number of these chronic conditions, including you can get benefit for depression, even gastrointestinal diseases, incident cancer. So you can see how these 7 lifestyle as well as physiological factors are so important. And what I like about this kind of a report is it's all things that I can change. It's not a genetic profile that has been given to me in that, oh, this is your risk. It is something that I can do something about it. So, as a PCP, I said that I am interested in improving everyone's heart, brain, and physical health, and also making sure this is all along their life course. So we take care of patients from childhood to elderly, right? So we want to make sure that this knowledge of prevention and about what it means to have a good heart and good brain is right at the, started early at that early age. Because, and as you can imagine, with these lifestyle changes they introduced earlier, it can reduce the incidence of global dementia by 30%, which is I think very good. In the absence of any great medication, I think just the fact that we have lifestyle approaches to help us is a great thing. But as I said, so it has to be done earlier and sooner, right? But it's never too late too. So it depends on what kind of a risk trajectory you want to be in. So the sooner you adopt some of these lifestyle factors, get excited about prevention, you can change your trajectory from being in the high risk, where you can get some of these chronic conditions, to being in the low risk category, right? So I find that, my role is important, because I see people not only when they have these chronic conditions, but even before, when they're busy raising kids and everything, that's also a very important time to talk about prevention. So I mentioned about these 7 factors, but you didn't hear me talk about stress, right? So where was stress in this? So I became interested in stress, particularly during these times when, people are going through, pandemic, and I see not only stressed patients, but even the healthcare system, staff, physicians, everyone is complaining of stress, burnout issues. So it was not something that I could ignore. And I felt like, how is this definition even complete when it doesn't have stress, right? And we know stress causes a lot of these problems too. Stress affects mood. Yeah, you have daily stress, you will find problems with sleeping. You will have more anxiety. Again, all kind of chronic conditions like high blood pressure, heart rate, cholesterol, all could be affected by chronic levels of high levels of stress, right? It affects our bones, it affects our immune system. So stress over the last few years, especially during the pandemic, has become an interest area of mine, because I feel like there is something we are missing in our conceptualization of a heart health or a good brain health, right? And if you can see this infogram regarding how COVID has actually added to stress levels, right? It is nearly 8 in 10 people say that COVID pandemic has been a significant source of stress in their lives, right? And it has also increased a lot in this past 2 years actually now. And the more I'm understanding about stress, it is a lot complicated because of how it acts and how it affects our behaviors, our thought patterns. So you can see how much of a response in terms of physiological response we get from chronic levels of stress, and also acute stressors, which we are sometimes not able to handle, right? And some people have the choice then. Either they pick on some good habits to manage that stress, but at other times they do things that are not helpful, which is sometimes it could be from the avoidance or aggression, poor judgment, or sometimes even worse, things like drug use. So how we respond to stress is actually more predictive of the kind of chronic conditions we might get in future. So now we also talk about this, that, with lifestyle changes, especially during this pandemic, it is just hard. There is no doubt about this. We have known this for a while, that good lifestyle means to eat right, do physical activity, 150 minutes. We have heard about this, right? The question is, what is stopping us? Why do we get paralyzed in the way we are? And that has got to do with sometimes the way we think about these things or not think about them, right? So we set the wrong goals, we don't enjoy the process, we do it alone, which has been happening to a lot of people. So I get interested in this because I frequently have patients who tell me that, yes, they are stressed, they know it is bad for them, they know they are not able to exercise, but they just don't know how to change. And that to me is a very interesting research topic too, is what is preventing us from change. So I've launched a series of studies in this direction because I know the importance of lifestyle for heart health, brain health, but what kind of a behavioral approaches does it take for people to change it, right? So my interest has been in how we can use some of the behavioral medicine or psychology approaches to intervene for patients going through daily stressors, daily unhealthy lifestyle, and do it. And we have launched another study recently, which is looking at community resilience, where groups of people come together and they go through an intervention. So it is not only the intervention that is working, it is also people talking to each other that helps to mitigate stress and also introduce new lifestyle changes. So you hear about what works for some person, the other person likes it. So just facilitator is just really moderating the session. The real interesting thing is you learn from each other, right? And also improve social connectivity, which we have all been missing. So, and with stress, which has been my new focus, and as I mentioned how much it affects us in terms of both physiological as well as behavioral issues, we're trying to understand is, that stress is good up to only a certain point, right? We also, if we live life without stress, you would probably miss all your deadlines and not do anything about that, right? So we want an optimal level of stress, which is good for us to make us functional and respond to the work issues. But at the same time, we don't want it to go to a level where it becomes unhealthy. So, and that's the area of our research. And another fascinating aspect of things we are trying to incorporate in our trials is this aspect of dual processes that are going on in our brain, which is being proposed by the Nobel laureate Daniel Kahneman, regarding our brain that works fast and the other side of the brain that works slowly. We often tend to make habitual decisions with a fast brain, right? Which is impulsive, automatic. And we want to sometimes slow it down, get it to our frontal lobes, and think about it a little bit more. And that's the process which we need to introduce lifestyle changes, because as soon as we do things in a more automated way, we tend to make wrong decisions, right? So this is the part we are also trying to incorporate in our lifestyle intervention studies to see if some of these interventions can actually change people's behavior and thus their chronic risk factors. So again, we all know about this, that protecting heart health, brain health, it all boils down to these common risk factors, which you are aware of through this Brain Talk series. You've heard about all this. But what is, again, preventing us from doing it is what we are interested in. So as I said, my focus is on prevention, but I also want to make sure the knowledge we have, how are we able to apply it? So I'll end my talk with, with some ideas about this, that, think about change more as a process and not as an event, right? And have that success plan. So I mentioned to you that even that small change that you can do with your personalized assessment in that lifestyle score, even one can actually improve you to a better, prevent so many chronic conditions, right? And doing things, being consistent. So I often tell my patients, just think about one thing in that day that you can change for a heart healthy and a brain, right? So just one thing, just do one thing. And that small thing is actually the most important, right? And you can start also, managing stress by this exercise where if you, I'm sure most of you drink, coffee or tea, hopefully it's not a Coke, then as you do it, you think about what you're seeing at that time. And think, and hear the sounds around you. So you're incorporating all your 5 senses, right? You're taking in the smell of the coffee. You're holding the cup warm, right? And then you're drinking and really enjoying the taste. So it's just a small tip for you for the holidays. Just try doing this with your cup of coffee or even anything you're eating. Again, try to get that thing also in the healthier side of the diet, which will be great. So with that, I wanted to wish everyone happy holidays and look forward to any questions. Thank you.
Thank you so much, Dr. Kulshreshtha. And I think that one of the things that our audience is real key on is staying healthy. So there are some questions that are popping up in the chat that may be directed to you. But one question I have is one primary care doctor to another, but more importantly for our audience, how does one address these kinds of things with their primary care provider? Everybody's not as astute as you are. So how do I get my doctor to give me more information about nutrition and what I should be doing? How do you suggest I approach it with my doctor?
Monica, I think that's a great question. I think, even as a PCP, I'm aware that when patients have that limited time with their physician, it almost your medication refills, your chronic conditions being managed like your diabetes and other things almost go first in communication. And we kind of almost never discuss lifestyle approaches with our physician. But I think to an extent, it's a little bit of a personal responsibility as well as the responsibility of the physician to engage in that discussion. And we don't have to, spend a lot of time on it, but just the fact that if you can take as a patient initiative to, talk to the physician about, tell me what can I do to improve it? I think that will start getting into the framework of thinking, not just medications. What can I do in terms of the lifestyle to change it? And then how can I change it? All of us are trained in it. It's just a matter of initiating that. And the initiation could come from the physician or the patient. So I would just, bring it up with the doctor.
And last question, and we'll move on to Dr. Suchindran, about dietary counseling. There's special dietary counseling for people who have diabetes, people who have kidney disorders. How does one go about getting a nutrition or a dietary consultation?
Great question. I think nutrition has become a very complex science because of how there's some definitely good principles about a healthy nutrition, but with some chronic conditions, you might have to modify to a high protein diet or a much more lower salt diet. So if you are seeing, your physician in the Emory healthcare system or another healthcare system, there is always options to ask for a nutrition consult. So they can, spend time with you to understand what does your food plate look like. I think that kind of a discussion will unfortunately rarely come from the doctor, but it will come with that discussion is very important and should, again, we should feel empowered to ask that question to our PCP or specialist that I need a nutrition consult because I need to know more. I think that's where it starts.
So thank you so much, Dr. Kulshreshtha. There are some questions in the chat that I'd probably like you to address, but just to summarize, the Simple 7 for life to help be more healthier and help prevent brain disorders is something that's available through the American Heart Association, right?
Yes, that is correct.
Okay. The other thing that I wanted to mention, and Dr. Kulshreshtha did a great job bringing this up, was that it's important for us to address things that we want done with our doctor. Ask for the nutrition consult. Ask for suggestions about how you can improve your blood pressure, your cholesterol, beyond just writing a prescription, and feel empowered to ask. Is that it, Dr. Kulshreshtha?
Absolutely. You summarized it so well. Thank you.
Thank you. Thank you so much, Dr. Kulshreshtha. Please send Dr. Kulshreshtha some questions in the chat and the Q&A. At this time, I'd like to introduce our infectious disease specialist, Dr. Suchindran. Would you please pronounce your name so that everybody knows how to say it correctly?
I think you had it pretty close. My first name is Sujit. My last name is Suchindran. Can you hear me okay?
We can all hear you. Go right ahead.
Fantastic. I had sent my slides. Are you going to be opening the slides, or should I share them from my screen?
You can, please. I made you a co-host.
Okay, great. So give me 1 second to just open them up. All right, can you see my slides?
Excellent.
Wonderful. Well, again, thank you so much, Dr. Parker, for inviting me to this forum to speak about, I was going to talk about respiratory viruses, and I think the main one you're going to hear me talk a lot about is COVID, but it's really a fantastic opportunity for me to engage with a different group of people. So really appreciate, Dr. Parker, for you thinking of me to speak to your group. So I am a physician in the Division of Infectious Disease in the School of Medicine. And I actually work as a hospital epidemiologist, where I have, during the course of the COVID pandemic, I was the hospital epidemiologist at Emory St. Joseph's Hospital in Emory Johns Creek. I'm joining you here right now from Emory Johns Creek Hospital, and I recently transitioned out of my role at St. Joseph's. But I wanted to first sort of tell you what that is, because you may not be familiar with what a hospital epidemiologist is or does. So I work with a fantastic infection prevention team at both of the hospitals, who are often, I would consider, the unsung heroes of the hospital. And we work tirelessly to prevent the transmission of infections to our patients in the hospital, as well as to our healthcare workers. So before the pandemic, a lot of things that we worked on, and we still think about, our prevention of things like infections due to surgery, or infections due to central line, special IV lines, or urine catheters. But in the COVID pandemic, that has certainly changed our focus a good amount. And certainly a lot of the last 2 years has been focused on all of our work around COVID. And I've worked very closely with our infection prevention teams to work on all sorts of prevention measures throughout the hospital, both to protect our patients and to protect our healthcare workers from being exposed or and for keeping them healthy. So I wanted to, I'm going to focus on giving you a COVID update and talk about some other respiratory viruses, but also really focus on, for this audience, in the lens of the neurological complications of COVID, as I certainly think that they'll be relevant and interesting to this group. So just our current status update here in the United States is that, unfortunately, in this roller coaster of a 2-year pandemic now, we're currently on an upswing where we're seeing more and more cases in the United States. Currently, our daily average is around 120,000 cases, and that's about an 85% increase in caseload since we experienced our nadir after a surge in September. So I am very concerned about the trajectory that we're experiencing right now. And you can see in the map on the right is CDC's map for showing levels of transmission for COVID in the counties throughout the United States. And you can see a lot of red, where really high levels of community transmission throughout the United States. You can see that in the Southeast, after we had our significant surge in the late summer, early fall, we have had some lower rates of community transmission that you can see in the yellow and even some blues there. But I am worried about in this holiday season, similar to what we experienced last year, the potential upswing in cases. And certainly I'm worried about the community spread of the Omicron variant, which you'll be hearing me talk a little bit about. Just to emphasize, though, that the COVID that we're seeing based on surveillance data remains to be mostly due to the Delta variant. So I get a lot of questions in my line of work about, what are these variants? And so they're basically, there's the original form of the virus, which then had different mutations. And those mutations sometimes mean nothing, but sometimes those mutations can lead to different traits of the virus that make them more worrisome. One trait would be that if a mutation has led to a virus, the COVID virus being, or that variant being more transmissible, that it's more easily to pass from one person to another. There's another concern that theoretical concern that a variant could lead to more disease severity, so that it would make people even sicker than the original strain of the virus. And the third, I think one of the most biggest concerns about a variant in general is the ability for it to have immune escape. That means things that we would normally rely on our immune system to protect against the virus, like through vaccinations or even prior infection, may not work as well if your body is exposed to a new variant, which has that greater potential for immune escape. I think one thing that I like to emphasize is that the emergence of variants is not inevitable, but we are expecting them because really the issue is when the virus has unchecked replication, and that really we aren't vaccinating people worldwide as much as we should be, there is the potential for these variants to develop. And you can see in the bottom figure that over the last few months in the United States, the predominance of the viruses that we've been seeing have been the Delta variant. But I am worried about the Omicron variant, which I will discuss a little bit about. So the Omicron variant that we're hearing so much about in the news now was a different variant, which was originally detected in Botswana and South Africa, and is now, as we're hearing about for the last couple of weeks, really found worldwide, including in the United States. The reason it was concerning is that based on the profiles of the mutations in the spike protein, which is the picture you see on the right, and that protein is the one where the virus uses to attach to the human cells and cause infection. There were concerns based on some of the changes and mutations in that spike profile that might lead to some features that are worrisome of this Omicron variant. And based on some of the very preliminary data that we have so far, I think we are very concerned that this variant, the Omicron variant, is likely more transmissible. So it's more easier to pass from one person to another compared to the Delta variant, or certainly the ancestral original virus that that developed in late 2019 and 2020. We're still, I would say, jury's still out on whether it causes more severe or milder infection. The data initially coming from South Africa shows that it may be milder, but there's a lot of confounding factors there in that the people that have been infected in South Africa have generally been younger, and there is a good degree of immunity from prior infection or vaccination. So it's a little bit hard to tell whether this Omicron variant leads to more severe disease. I think the final concern is this one of immune escape. And I think that we are concerned based on some of the preliminary laboratory evidence that perhaps our vaccines may be less effective at preventing the spread of the Omicron variant compared to the original. But I think that we are seeing that especially with booster doses of vaccine, that there are likely high levels of antibody protection. So I think that one thing that I certainly recommend to everyone is strong consideration of getting a booster dose to your vaccine. And I think as we worry about this variant spreading in the United States, that I continue to recommend that in addition to getting vaccinated and boosted, that we continue to do all of our layered prevention measures. That includes things like masking when you're indoors in public, social distancing, certainly washing your hands, and sometimes even rapid testing is something that I would consider as part of that layered prevention measure. So much of what my work has been on vaccination, really getting educational COVID vaccination out there. I think this has been one of our weak points in the United States. And I looked at the data as of this week. In the United States, around 63% of the population is fully vaccinated. So that includes children, the whole population. Around 63% of our population is vaccinated. And you can see some very significant geographic disparity in those rates of vaccination. In Georgia, we've consistently lagged behind in the vaccination rates compared to the rest of the country. And in Georgia, only around 50% of the population, again, the total population, including children, around 50% are fully vaccinated. The other sort of current state is that that booster doses are really recommended for all adults. And that's partly because I think that of the concern for things like waning immunity, and especially with the data we're seeing about the Omicron variant, booster doses are recommended for all adults. And now actually very new is that booster doses are also recommended for children aged 16 to 17. It's recommended that they get a third dose. I was very excited that the recently children aged 5 to 11 also became eligible for vaccination. And I was very excited that my two children aged 6 and 9 were able to get both doses of their vaccine just within the last few weeks. So certainly, although a lot of headwinds, some things that I am very optimistic about. I did want to spend some time with this group about talking about neurologic complications of COVID. I think it's would be of interest for this group to know that although we certainly think a lot about the respiratory and cardiac complications of COVID, there are very profound neurologic complications of COVID infection. And I think one thing that goes unrecognized is the frequency with which this happens. Among people who are hospitalized with COVID infection, around 80% of people experience some sort of neurologic complication or neurologic symptoms. And among those patients who experience the neurologic symptoms, there's higher rates of mortality. So these are really worrisome complications that we think about, these neurologic complications. And it's still not fully understood why a primarily respiratory virus leads to neurologic complications. There's some thought that there may be direct viral infection into the nervous tissue, but also some thought that perhaps it's the body's inflammatory response as it's responding to this significant infection that causes inflammation either in the nervous system or in the blood vessels that supply the nervous system, things like the brain. So I think the jury is a little bit out on this as to why we see some of these, I would say, unexpected complications, but certainly they are not uncommon. One of the most common neurologic complications is actually one not seen in hospitalized patients as frequently, and that's dysfunction in smell or taste. this is really one of the characteristic features of this infection, and is experienced by anywhere somewhere between 1/3 and almost 3/4 of people, especially in outpatient surveys, so people who are not hospitalized. And we certainly have seen, based on data, that sometimes this neurological complication can last for weeks to months, even after recovery from the infection. In the hospitalized patients, I'm going to mention a few more that I think are, very relevant. And I think that, as I mentioned, can be harbingers of that very severe infection, and can be demonstrate that people may have more likely to have additional morbidity and even mortality, death associated from COVID. So one is encephalopathy, which is we sometimes think of as sort of disordered thinking or disordered brain function. And based on different studies, which I've sort of highlighted there has been a variable incidence of this kind of encephalopathy or disordered thinking and confusion seen in admitted patients, with one study in China showing there was low frequency, around 3%, but another study from Spain showing upwards of 20% of those patients admitted to their COVID units had symptoms of encephalopathy. Another one, which is rare, but I think is very important, is meningoencephalitis. And this is really thought to be direct inflammation or direct infection of the brain or the spinal cord or the meninges, the protective layer surrounding the central nervous system. There can be direct infection or inflammation of those structures. And the way that you can often see that is through doing a spinal tap or a lumbar puncture, where you see extensive inflammation in the spinal fluid, or you can see it directly on MRI imaging. And so these examples that I've provided on the right are from some published studies showing meningoencephalitis due to SARS-CoV-2 or COVID virus infection causing this kind of picture. This is a little less common, I would say, but certainly one that has been noted and documented in the medical literature.
One question, Dr. Suchindran.
Mhm.
This meningoencephalitis and encephalopathy, what is your trigger that might be what's going on? Do you get a CT scan or an MRI on everybody who's confused, who's admitted with COVID? How would you know? I'm trying to understand that.
Yeah, it's a hard question to answer, because sometimes being in the hospital itself can lead to encephalopathy. And there's so many other reasons why people who are admitted in the hospital can have encephalopathy. Things like the medications, one of the most common, there's so many neuropsychiatric medications that are given, sometimes for pain or sedation. So it can be very difficult to tease out sometimes. So I think that one thing that I would look for is that if there's no other alternative explanation for a person's symptoms, these may be something to think about. I think they don't necessarily often affect the way you treat someone in terms of their COVID, the management of the COVID directly. But I think, for example, it is important. There can be other mitigation factors that can be done. So I think the bottom line answer to your question is it's very much sort of something where you take in all of the clinical parameters. And if you sort of are not sure, or this remains one of the possibilities, you have to do additional investigations like imaging, or even consider a spinal tap. Does that help answer your question?
Yes, and I think that there's a question in the Q&A, and it answered that question as well. So the answer to the question is encephalopathy and meningoencephalitis may look like other things, and there's a lot more of a decision tree that you have to go down before you make that diagnosis or get that diagnosis. Is any of that treatable? Does it resolve?
Yeah, I mean, that's a great question. There's not when I think about specifically the meningoencephalitis, there isn't really great evidence that, treatment with the some of the conventional COVID, like antivirals that we use, is a direct treatment for the meningoencephalitis. So oftentimes we're resulting on kind of your immune system to really help clear the virus. Certain times in certain infections, when the antivirals are given, sometimes you will directly give them into the meningeal area, and that but that kind of treatment has not been studied and has not been shown to be, nor has been shown to be effective in this. So oftentimes it won't necessarily change what you do in terms of treatment, but it's sort of for knowledge and can help provide prognostic, a prognostic sort of guide to help figure out how someone might recover or over what period of time they might recover. Another neurological complication, which oftentimes happens after the initial infection, but can certainly hospitalize people, children and adults, is called multisystem inflammatory syndrome. So there's one which we call MISC, or multisystem inflammatory syndrome of children, and one MISA, multisystem inflammatory syndrome of adults. And again, as I mentioned, this is typically after people develop an infection, and then a number of weeks later can develop this really systemic inflammatory response. Most commonly, we see this affect things like the heart or lungs and lead to protracted symptoms, but there can be neurocognitive side effects or symptoms as part of the multisystem inflammatory syndromes. These can include things that really mimic that encephalopathy, confusion, and other cognitive impairments that can be a long-term consequence of COVID infection. And actually, before I get to my last one, was that another thing that I think is important to think about is that patients who are admitted to the hospital for a very long time, whether it's in the general wards or the ICU, can often develop neurological complications just from being critically ill for so long. Think about people that have been bedbound for a long time and lose a lot of strength. They can develop neuropathies or inflammation of nerves and muscles, which can lead to protracted damage and can really take very long periods of time and intensive therapy to recover from. The last one, which I think is certainly an important one, is post-COVID conditions, or what we in the press hear as long COVID. And these are symptoms similar in the idea to the multisystem inflammatory syndrome that really develop after the initial infection and continue for weeks to months later. On different surveys of people who have, quote unquote, recovered from COVID, somewhere between 1/3 and 60% have some sort of persistent symptom weeks to months later. And that number of these can be neurologic as well, with things like cognitive impairment. One common one that we hear about is this, quote, brain fog, which can lead to really significant impairment over a long period of time. So although we conventionally think about COVID as a respiratory virus, I hope I've impressed upon you that there are significant neurological complications of the virus, which can really portend very bad outcomes and can lead to prolonged suffering for people. I spent a lot of time on COVID, and certainly that's the thing that we're dealing a lot with. But in my line of work, I'm also would be remiss if I didn't say that we are in the midst of respiratory virus season. And last year in 2020 to 21, we had a very unusual respiratory virus season. We did not see very much influenza activity at all, and very decreased of other kinds of seasonal respiratory viruses. And a lot of that thinking was that it may have been due to some of the other COVID risk mitigation efforts we were doing, like masking and social distancing. But as we've relaxed some of those efforts over the last few months, we have certainly seen an upswing of our traditional respiratory viruses, particularly influenza, which can be deadly to children and particularly children and the elderly. And there have been a couple of very large outbreaks of influenza. One I'll point out at the campus of the University of Michigan among predominantly younger people, and another in New Jersey. But we certainly are seeing a lot more influenza-like activity in Georgia and across the US. The Georgia DPH publishes and keeps track of the influenza activity in the state. And you can see over the last few weeks from the beginning of influenza season, you can see in the yellow and green, which are influenza A and B, a real upswing in the number of cases that we're seeing in Georgia. Overall, the numbers are still overall low, but when I see that trend look like almost an exponential trend, I do worry about that we may see what we call a twindemic, which is an epidemic of both influenza and one of COVID that we're continuing to experience. So I think that one of the most important things I would share with this group are that the importance of getting vaccinated for both influenza and for COVID, including getting your booster, to really help prevent the transmission, to help keep you healthy and to prevent the transmission of these respiratory viruses to others, either your family or those people you work with or are close to. And I think that was sort of my whirlwind tour of COVID, neurological complications, and don't forget about flu. And I'm certainly happy to take any questions, and I'll try to look in the chat in the Q&A.
Thank you so much, Dr. Suchindran. That was extremely important. So one thing you did mention, and you told everybody to please get your COVID vaccines and your flu vaccines. Make sure you get them, but also advise your family members, your grandchildren, to also get their flu shots. We're about out of time. Matt Doiron wants you to tune into the Cognitive Empowerment Program. We're going to be online, so if you have some questions for Dr. Kulshreshtha and Dr. Suchindran, please put them in the chat such that they can answer them. Our formal program for Brain Talk Live has concluded. For those of you who have to leave and get on to Cognitive Empowerment Program, please do that. And we will be answering questions in the chat for another 10 minutes or so, okay? Okay, there's one here.
Can you go ahead and tell us who's going to be on at 3 o'clock while the questions are still coming in for the presenters?
Yeah, and I'll be really quick. So today we're joined by Greg. He's our new nutritionist, and we're going to be talking about staying healthy through the holidays, especially these big holiday feasts coming up. And specifically, we're going to be talking about sugar and its effect on the body and the brain. So hope everyone can join us. I just posted a link in chat to register for our free webinar. It's going to be in any minute now. So come please join us.
Okay, Dr. K and Dr. S, thank you so much for your presentations. That was really good. I really want to tape both of them to share because we've got a couple more programs coming up. But I think the questions about the encephalopathy is something that gets a lot of their attention. They also seem to have a lot of concerns about nutrition. Again, this audience that we're appealing to is older. They're pretty active and they're pretty engaged. And I think we need to probably start asking how many of them are actually immunized. But I think this group probably is more so than any other group, and they need to encourage the other people. But this group probably is. They've probably all got their boosters. Thank you both. You're free to leave.
Thank you so much. I'll just take one last look at the chat.
There are more questions still coming into the chat.
There are?
Mm-hmm.
Okay. Yeah,
to Dr. S, do you have any data about neurological complications of getting both booster and influenza shots together?
We certainly have an abundance of data showing that getting those vaccines together is safe and effective to do. And I recommend that if you're able to get them both at once, you should certainly do so. I think one thing that we have learned from the essentially millions and upwards of billions of people that have received these vaccines, and they continue to prove to be very, very safe, number one, in addition to being effective. So I don't have any concerns about the side effect profile of the vaccinations, and I do recommend that you get them together if you need to.
A lot of questions from assisted living facilities and about shots and other things. I think most of them are on Johnny on the spot for getting them. Has either of you seen where they're not attended? Nursing homes definitely are. Getting the COVID vaccinations across to assisted living facilities. I'm not sure about that one.
There's a question that asks why people who've been fully vaccinated and boosted still potentially affected by variants.
Yeah, I mean, that's a great question. I think that we know that the vaccines, they're very effective at preventing infections. they're not 100%, but they're not necessarily designed to do that. I think the most important part of the vaccines is that they prevent severe infection and hospitalization. So I think that we do expect there to be some post-vaccine infections, particularly if the virus has mutated somewhat, like as we're expecting with the Omicron variant. So I think that yes, that may happen. It is less likely, but it does happen. And I think the proof that really the most important thing is that they keep people from getting very, very ill.
What about, there's a question here about pneumonia. Pneumonia vaccines. We talked about flu and COVID, but we didn't talk about pneumovax. Have you?
Yeah, I would definitely encourage all the participants here to talk to their physician about whether they qualify for pneumonia vaccine, pneumovax or others. And there's a new pneumonia vaccine coming out soon as well. There are typically people who are elderly, but others who maybe are not elderly but have other comorbid medical conditions could benefit strongly from pneumovax. So I think I would urge you to talk to your primary care physician about whether you would benefit from pneumococcal vaccination with pneumovax.
Okay, I'm going to sign off, Cornelia.
Thanks so much for the opportunity.
I think we're good. Thank you. That was
All
very
right. Thanks,
Right.
everyone. We will be back here next Tuesday with Dr. Ken Hepburn. He will be sharing information to get you prepared to host family members if you are a loved one caring for a person with memory impairment. He's going to be sharing those essential tips next Tuesday. And then we're just going to have trivia and probably have John come on live and do a little aerobic exercise with us. We want to continue to stay active while we are going into this holiday season. And we want you to keep moving. So again, remember, this session is being recorded. You can always go to our YouTube channel and review any of this content. So we want to see you back here Tuesday at 2 p.m. Eastern, and go ahead and head over to CEP Live. Thanks for joining.